The aim of the Cardiac Rehab Program is to introduce exercise and some of the risk factors that lead people to heart disease, to show folks how to manage their own risk factors, and also to live life to the fullest after they've developed a heart condition. There's a lot of scary things that happen, and so this is just an introduction on what can be done and how we can help. The Cardiac Rehab Program is multidisciplinary, so the doctors are involved, the nurses are so supportive. The cardiac rehab staff include a physiotherapist, a social worker, a psychiatrist, a dietitian. It really does take a team, and when you know as the patient living with heart disease that you have a team supporting you, you can do anything.
I didn't feel like myself. That's for sure. I didn't feel like myself at all, and I was broken, kind of. I was like, wow, what just happened? The people who ran the program were excellent. You were never afraid. They helped you anytime. Like half the time I couldn't even program the machine to work, so they had to come and do it for me. So that's what they did. But the other thing is that they would push you when you needed that little push. And at the same time, if you were having not so great a day in the gym and you said, I didn't do that exercise, that was okay too. They were really invested in each one of us and really looking for our success. They were great. It's amazing how strong you feel by the time you end that program. And I was so proud at the end of the program because I have biceps now. So.
Those first few months after surgery, you're waiting to start cardiac rehab, and you really wonder, am I going to feel the same way again? Or am I going to feel like that person I was before I had open heart surgery? And I definitely felt that during the program, you gain that confidence back. You start seeing those small gains, and everything about your life is a lot easier. So if I wanted to go play with my daughter each week, I could do a little bit more with her because of the cardiac rehab program. It was starting to build my stamina back up. You definitely get that confidence back that, hey, you know what, hey, I survived that surgery. It was a big surgery, and I'm putting the work in at the gym, but now I'm seeing those gains in terms of being able to kind of have that life back that I was craving.
I would say building up someone's confidence is kind of my favorite thing about working in this program. A lot of the times people come into the gym and they see the equipment and they see the weights, and certainly building up the body is one part of it, but seeing someone learn to trust their body again and learn to be independent in the gym, and their energy starts to kind of bolster, and that's such a wonderful thing to see. You see someone move from being kind of timid and up to where they're just laughing with the other participants and with me, and they're just able to move through the space with a lot of confidence, and that's one of my favorite things.
I've always been a fit person, but I think in some ways I'm probably more fit now than I've ever been because of the mental guidance and professional guidance I got. It's one thing being fit, it's another thing being fit, well, and mentally stable and doing well, with the adjustment to lifestyle that you have to make. And I thought, wow, that's a really good example of if you feed your body exercise, it will respond, and it will respond positively.
I guess one of the main things for me about the Cardiac Rehab Center is how it's changed my life from of no hope, whether my life will ever be continuing on in the same manner as it did before. And just the living in today rather than in the past or in the future. And then looking forward to tomorrow, and trying to get as much as I can out of today. And spiritual sort of a way, I guess, and just don't give up.
What I try to bring out of people is what brings you joy. How can you get out and move in your life in a way that's meaningful to you, that brings you happiness, that connects you with your community. And so seeing a person transform from maybe that sort of uncertain, they don't know what to do, to at the end where they have that confidence and they've found a way to integrate movement and exercise and activity into their life is like just the best thing. I love it.